Good afternoon, Bermuda. Thank you for joining us as we discuss end-of-life planning. Today, Jean Flath, Chair of Final Steps Bermuda, will provide us with a presentation on being conversation ready for end-of-life care. Also joining us for the Q&A segment is Sarah D'Alessio, member of Final Steps Bermuda. As a reminder, you are welcome to place your questions in the comment section below for our experts. Before we begin the presentation, I want to welcome you and provide you with a little bit more information about the Bermuda Health Council. The voice that you are currently hearing is Taja Fox, myself, Communications Officer at the Bermuda Health Council. You are welcome to contact me if you have any questions about today's discussion or for future community discussions. Now, who is Bermuda Health Council? The Health Council monitors health services and coordinates health systems information for stakeholders to ensure Bermuda's residents have access to safe and high quality care. Why do we exist? Well, we exist to enhance the quality of healthcare and to promote a sustainable healthcare system. Some of our tasks, but not all, are licensing of health insurers, the regulation of health service providers, and we also provide relevant health information to our public. Just like today's discussion, we want to ensure that we provide you with information that could prepare you for better health. If you have any questions or concerns regarding Bermuda's health system, you can jot down our information here and reach out to us at any time. The Health Council is happy to assist you. Now, let's begin our presentation. As Chair of Final Steps, Jean Flath will provide you with information for end-of-life care. Jean, you have the floor.
Good afternoon, and thank you all for joining us on this presentation. My name is Jeannie Flath, and I am the chairperson, as Teja said, for Final Steps Bermuda. We are not medical professionals. We are a grassroots volunteer group, and we want to help our community to normalize conversations about end of life and dying while we're still healthy, before we're in crisis. We hope this presentation will help you to make a start, to choose, to communicate, and to document for your inevitable future. Conversation ready refers specifically to the ability to engage in end-of-life conversations with your partner, your loved ones, and or your healthcare providers or caregivers. Yes, recognizing that we are mortal really does change everything. Acknowledging that your time here is finite brings up lots of emotions. And it's a fact that very few people are comfortable discussing the two unfixables: getting older, some of us are getting there faster than others, and also death and dying. There are many reasons why we choose to be silent. Denial. We can actually trick ourselves into believing we've got more time. We're young, we're healthy, we eat well, we exercise, we don't drink, we don't smoke, or we come from a family with longevity. But the truth is that we really don't know what the timeline of our life is. Cultural taboos. Well, we really are in the West living in a death-denying culture, so it's very easy to make death one of the major cultural taboos within our framework. Family dynamics and customs. Some of us are worried that we might say the wrong thing, or we might cause somebody to feel badly, or we might cause a bigger problem. Superstition. This is a big one. We all seem to have some level of superstition about talking about death because it is mysterious. That saying the D word somehow will invite death automatically into the room. We know this fear is not rational, but we avoid the topic of dying and death nevertheless. Religious beliefs. Some people believe that planning for their end of life care is equivalent to having a lack of faith in their God. Lack of time. I'm too busy. Well, this is part of denial, that we think, oh, I am too busy right now. I have time. I can put this off. I have time, until you don't have any more time. Avoiding discomfort. We are human, and whether our discomfort is physical or emotional or psychological, we are hardwired to avoid it. Mental math, hard work, you name it. And we've got a myriad of ways to avoid these difficult and discomfortable conversations. We don't want to destroy hope. This is a big one for family members and also for medical practitioners. And what we have found is that if we can start this conversation early while we're still healthy, we can have a meaningful conversation before we're in a situation where we're in crisis. Lack of experience and understanding. That's why we're here today. We're hoping to be able to give you some tools to give you more experience in being able to start these conversations. And also, we want to give you the understanding of how absolutely necessary it is to start these conversations early. The communication gap. 90% of US adults have considered their end of life choices, and 30%, only 30%, have made those or shared those choices with someone else. And remarkably, less than 10% have shared those choices with their physicians. So if you are in this category, then you are in very good numbers, because most of us are. If you haven't asked your loved ones what matters most to them, you might unintentionally cause them emotional, physical, or financial harm by advising, urging them or their physicians to take actions that actually conflict with their values or their life goals. Here are some of these questions that should be asked. Do you want a feeding tube? Under what conditions would you want to be resuscitated? Do you want to be on a ventilator? Do you want to be pain-free entirely, or do you want to have some moderate pain so that you can still communicate with your loved ones? Where do you want to be? Do you want to be in the hospital? Do you want to be in hospice care? Or do you want to be at home? These are all valid questions that should be discussed. Research has shown that persons who engage in end-of-life planning and conversations with their loved ones have less anxiety, less fear, and grief during and after the end of the life process. This is based on having a level of confidence in the decisions you have to make on behalf of someone else who may be unable to make those decisions. %. Healthcare professionals' training and focus is on curing and extending quality of life. And this is really a good thing. But when it comes to end-of-life conversations, healthcare professionals are human too. Frankly, they are not exempt from being hardwired to avoid difficult and uncomfortable conversations. The good news is that increasingly more time is being focused on education around end-of-life care and planning for doctors and healthcare professionals. We encourage healthcare professionals to increase their comfort and engage in these conversations. We also encourage patients to have the confidence to request that they have these discussions with their doctors. The following video will demonstrate how easy it is to do unintentional harm.
My dad was born 30 years to the day before me. Probably one of the reasons why I'm David Peter Wood Jr. Right around my age, we went out to dinner, and he said, Dave, you have some papers to sign here. These are power of attorney. This is my advance directive, all this kind of stuff. I go, what's going on? And he said, I just want to get this done. You're the only doctor in the family. And, I just want to, make it clear to you that you have this responsibility. So he said, just promise me that I won't wind up in some nursing home watching daytime TV, getting fed by a tube. I guess about 15 years later, I get a phone call from a hospital in Cape Cod. And they said, your dad is in 4-point restraints, out of his mind. Long story short, after about a month, a stroke, pulmonary embolism, he gets diagnosed with West Nile virus, encephalopathy, whole 9 yards. I see him every single day. And then I go visit him in the rehab center, and there he is, sitting in a wheelchair, strapped in, getting fed by a peg, watching daytime TV. Now, did anybody along the way ask me, what did your dad want? No. But did I verbalize it? No. It's this cascade. You don't realize until you're on the other side how this slope goes, and yeah, he'll get better, all this kind of stuff. About a week later, I get a phone call. It said, we just took your dad to the local hospital emergency room. Oh, no. I said, do not reset. And he goes, nope, our policy is, if they get a fever over X, we take them to the emergency room. I go, but I signed these papers. No, in the fine print, it says that we have the right to be able to transfer that person. So it's about midnight. I get a phone call. Your dad's in the ICU and he's not doing well. I go, wait a minute. This is do not resuscitate. He goes, oh, that was at the nursing home, I guess, but you didn't do it here at the hospital. I said, I'm not going to let this happen again. So I put on my clothes, put on a pair of scrubs, and I just walked right into the ICU. The monitor says my dad's blood pressure is 80/40, heart rate of 150, and they're jabbing him in his groin because they can't get IV access. Poke marks everywhere. I go, stop. And they go, who are you? I go, I'm his son. They go, well, we can't stop. We don't, he's in the ICU. I go, stop right now. Give me your attending. Oh, the attending's not here. Just the residents. I go, get the attending in here. And I want you to stop right now. They go, well, we're going to have to call security. I go call security. Go ahead. So isolated, right? Nobody supporting me, trying to do what I know my dad wanted me to do. And I did it. I was able to get into bed with him, and he died. But I reflect back on how much better that experience could have been for me and for him if someone would have said to me, what does he want? What do you want? What are your issues? What are your concerns? What is the never event that you want to happen? Because I would have told him, I don't want him going to the ICU. If we could develop a culture where it wasn't, checking the box and filling out Epic, but instead saying, what does the patient want? What does the family want? I think that experience, which was horrible, as you can see, to this day, right? This is years later, could have been a pleasant, tragic, but a better event.
A better event. How do we get conversation ready? Well, all the indicators are that we need to start early and that you need to start with yourself. As I've said, having the conversation about end of life planning and also planning if you can no longer act for yourself is scary and it's uncomfortable, but it is essential. If we are thinking of needing to start this conversation with somebody else, but we haven't had that conversation with ourselves, you need to start there. We don't really know what the timeline is. I think our road fatalities and accident rates and now COVID show us that being prepared is essential regardless of our age. And I always say that if you're old enough to get on a motorbike, you're old enough to start this conversation. Also, starting with yourself will help remove some of the fear and the anxiety and the stigma about having this conversation with somebody else. Once you get your head around your priorities and you start answering some of those questions, it will make that conversation flow more easily. Luckily, there are some great tools out there that can help us get started. The Institute of Health Improvement in America has created conversation starter guides, and we have 3 of them on the slide right now. It's a great place to get started. On the left, there is a conversation starter guide that is actually just a general conversation starter guide. In the middle, I pulled a guide that can help you to talk to your healthcare team. And then the third one is for caregivers of people who have Alzheimer's and other forms of dementia. You should know that these starter guides come in many languages, including Portuguese, which is important for our community. I just want to talk for a minute about the first steps of the general conversation guide, because it doesn't start with a lot of complicated medical questions. It really starts to ask you questions about what you consider a good quality of life. The first question is, what does a good day look like for you? It can be anything. It can be going out in the gardening, just staying home and being curled up in the air conditioner with a good book, or going out for a walk or a run. There really isn't a right answer. The second question might be, what or who supports you in difficult times? And this is about really trying to get a better understanding of what your support system is. Is it a spouse? Is it your children? Is it your parent? Or it also could be a minister, a doctor, or even your lawyer. The third question is, what matters to you through the end of your life? And this can be a bucket list of what you really want to do. It could include your faith, your family, being independent as much as possible, or being able to spend more time with your family. There are no wrong answers to any of these questions. There is another toolkit that I wanted to talk about today, the Stanford Medical Letter Project. The Stanford Medical Letter Project actually has templates of letters that you can write to yourself or to somebody that you love or to a doctor. They provide easy templates, and it could be what matters most to me, who matters most to me, or a bucket list. We have some examples in front of us that I just wanted to go over really quickly. What matters most to me? The examples could be being at home, doing some gardening, going to church, playing with my grandchildren. My important future life milestones. Well, this is really about a bucket list or things that you really want to do. And then the third one is, here is how we prefer to handle bad news in my family. This is a good question, and it gauges where your family is in regards to having difficult conversations. Examples could be, we talk openly about things like this. We shield the children from things like this. We do not like to talk about things like this, or we don't really want to tell the patient everything. The fourth one really makes me smile. Here is how we make medical decisions in our family. The first example is, I make the decision myself. The second one is, my family has to agree on all major decisions about me. Well, that's very democratic, but I bet it's really complicated. And then the third one, my daughter is a nurse and she makes all the decisions. Well, I have a daughter, she's not a nurse, but she would love to make all of my decisions for me. We're going to just now go on to a short video, which is all about the letters that you can write in the Stanford Letter Project.
What matters most to me is to lead each day to the fullest with my family near to give me their support. Never hide a medical issue. Talking openly and candid is the way I handle bad news.
I write letters for the doctor. It helps a lot because life in this world is but short and we don't know what will happen in the future.
It's very important because at least I will know what to do when I am going to die and what my family will do also for me.
I would not want to stay home when I've had a lengthy illness to be a burden on my family. So having this letter would give the doctor an opportunity to do the things that I want to have done as my life is ending or as it ends.
In case something like that happened to me, I don't want to live in a machine. I like to let go. Because why suffering? Why wasting all the hospital money?
And what I want at the end of life, I want to be pain-free. I want to spend my last days in the hospital, but not in the what is that, life support.
It states exactly the information that you would like your doctor to know. In a lot of families, there's bickering that goes on depending on how many siblings you have. But when it comes down to it, you want to be respectful to the wishes of your parents.
We really don't know what will happen, especially that we are getting old. There might come a time that we cannot tell something about what we feel to others, our relatives or the doctor. So it's better for us to tell them as early as we can.
Obviously, it's a comfort to know what he wants, and so that we aren't burdened with not knowing what to do in his last moments.
One of the worst things in the world that you can have happen to you is being on your deathbed and you're putting the burden of life-altering decisions on a family member that has no clue of what you really want or don't want.
If I'm brain dead, unplug me, and I want to die painless. No pain. Just put me to sleep and don't let me wake up.
You want to be buried or you want to be cremated?
I want to be cremated.
We don't like to talk about things like that. Just put everything there in writing with them. They take care of everything.
You have a brief discussion once every 10, 20 years. Who's going to remember that? So it's good that I can clearly say that, save me if you can, but if you can't, save someone else.
We feel important about this because we are asked about what's our opinion and what's our idea, how we want to die. Sometimes we don't want to talk about it because nobody wants to die. But that's the only thing that's for sure. It's very certain that we will die. So it's better to talk about it before that thing will happen.
Write it down early so your doctor knows exactly what you want. Don't be ashamed of it. It's going to happen. Everybody dies. Just discuss it and agree on to what you want.
Conversation ready. What it really means is closing that communication gap with yourself first, then the people that you love, and then your healthcare team. Once you do that, once you have those conversations, it will be easy for you to start an end-of-life plan. That plan can include where you want to be, who you want to have as a care provider, who would you want to have as your healthcare proxy in case you can no longer make any decisions for yourself? What kind of medical care do you want? Or what kind of medical care don't you want? Who do you want to have by your side? All of these are questions that can be written down. We are mortal, and the two things we have in common are that we are born and we will die. Starting an end-of-life conversation before we are in crisis won't stop us from grieving when that time comes. But choosing, communicating, and documenting our wishes will help our loved ones get through with less stress, less fear, knowing that they respected our plan. Before everyone starts to feel like this guy, I want to thank everyone who signed on today. I only have one more slide to show. That slide is actually the homepage for our website here in Bermuda, finalsteps.bm. On the website, you will find all of the tools that we discussed today under the toolkit button. Also, there's a lot of information under resources. We can all work towards normalizing this important conversation. Our hope is that this presentation will help you take that first step to making meaningful choices for end of life by choosing, by communicating, and by documenting your end of life plan. I'd like to take this time to thank Tajay Fox and the Bermuda Health Council for making it possible for Final Steps to do this presentation today. And I think we're now open and ready for a Q&A. And I would also like to invite Sarah D'Alessio, who's another member of Final Steps that will be helping us answer questions.
Yes, thank you so much, Jean Flath, for the presentation. It was wonderful. I will encourage everyone, if they can or would like to submit your questions in the comment section, and we'll be happy to answer them. But let's go ahead and start off with our first question as Sarah joins us. One of the questions that we previously had submitted was, what can I do if my loved one is really resistant and uncomfortable with talking about end of life? They say, you know, what I want, or you and your siblings will work it out. So what can you do as a loved one when it's, you know, uncomfortable to get to planning end of life care?
Absolutely. Thank you so much, Taja. I think that's a great question. When I was asking some colleagues in my office, like, what are some questions that you think would be good now? This was the first one that came up. I'm uncomfortable, or my family member is really uncomfortable. How can I start? I want to reinforce what our chair Jeannie said, that starting with yourself is always that kind of first step, because sometimes some of that discomfort you realize is a little bit more about you than them. And it's also, though, a great way to kind of start a conversation. I'll be very practical with tips here about doing this. Sometimes it helps to say, you know, I was thinking about what I would want, A, B, and C. What have you ever thought about this? Kind of, it's a way to broach and get into that conversation with someone. I think another key step is, this is not a one-time conversation and you don't have to do it all at once. We really recommend that you start small if you've got someone who you know is uncomfortable, and just start kind of testing the waters. The conversation starter guide is a great way, because of some of those initial questions. They're much more broad. They're not getting very specific in terms of end of life and dying. They're starting with more what matters to you. And that's kind of a great intro to help people feel more comfortable. Also, some tips that we've heard, we host some departure lounge chats, which is people just getting comfortable talking about these questions. And one of the tips that was brought up by a fellow community member was, make sure you go somewhere where they're comfortable. If they're happy is talking about tough things while they're going for a walk, going for a drive, having that dessert out somewhere, or doing this in their own home, know the person you're going to talk to and figure out where you think they will be most comfortable, just to start this conversation. And just remember that it's something that you can do multiple times. There's no wrong answer. People can change their minds. But what's really important is to start engaging and start documenting, and then coming back and starting again.
Yes, yes. And also with that a line of thinking and the conversations that we have to have with our loved ones, I know some of the questions that will center around this is, what should they consider, or myself, what should I consider when choosing a healthcare proxy?
Absolutely. I think that's a really important question, because sometimes the answer is not always what we think. Obviously, someone you trust is very important for this position. Someone who is able to kind of make quick decisions and engage with a healthcare team. You want someone who can do that. But you're also going to want someone who, even if they disagree with your decision, or they have a view of end of life that is different from yours, they're still going to respect what are your wishes, and they're still going to advocate for your wishes. So sometimes that's not necessarily the person you're closest with, because sometimes that child or that spouse, they might not be able to separate their own needs and their own wants with what they would want, or what they would want for you, from what you want. And so sometimes it can be maybe a more distant family member, maybe it's a good family friend. Some people even use professionals in these circumstances, but it really depends on who you can trust and who you think can advocate for you and really uphold your wishes, even if they're different from their own.
Exactly. I appreciate that response. Now, what can a person do if you're no longer able to express their wishes? Because things do change, just like with the pandemic. So much has continued to shift and transition. So what can a person do?
Yeah. I think one thing that I would love to refer people to as well, a lot of circumstance in this case, for example, if we don't start early, we see a lot of folks who have a dementia that's progressing, for example, and the family members are now concerned of, are they able to have this conversation, and what would this person want? There are some great resources online that Jean did show about starter kits for people with Alzheimer's and dementia and how to engage in that process. So I think there's a couple I can answer that question from two angles. From a dementia perspective, depending on what stage they're at, can really depend on how you can engage with folks. Always remember that just because someone might have some form of mild cognitive impairment, you can still engage and ask questions to understand where they are. Some persons in the field recommend when they advance to a more moderate stage, you can use reminiscence a little bit, talking about their past experiences of death with other persons and see how they reflect on it and what they speak to that's comfortable or not, or what they were comfortable with or not, and see if that can give some insight. With folks who are unable to communicate or you're unsure of that, a key step is to talk to those around them that knew them and think about what values they expressed or did express in the past. And that's really the best we can do in those circumstances, is to try and generate enough knowledge around this person of what they may be wishing or what may have been said. It's definitely not an easy thing. I acknowledge that.
Yes, it definitely isn't. With keeping in mind that, we have to have these conversations, yes, they are uncomfortable. So for some, a checklist is often essential and helpful in this line of planning. So what can a person do with their end of life planning document once it's completed? What does that process look like?
Absolutely. So I think the Beaumont video with the chief medical officer who was talking, it kind of showed a little bit of the reality is you can have an end of life document, but the only benefit it serves is the people around you know it exists and what's in it. So especially here, there's what we would recommend. We would always say, ensure your healthcare team is aware of it. Talk to your doctor. He should be instrumental in you kind of helping to develop your advanced directive or your end of life plan. And you would want a copy whenever you do have that finished on file with your GP. You can also put a copy at the King Edward Memorial Hospital in the HIMSS network, which is the Health Information Management System network. If you go on to bhb.bm, you can look up the Health Information Management system and how you can contact them to get your information on file there. Sorry. So you're on file for that. It's also really important that the person that you've appointed as your healthcare proxy knows. There's cases where people have been appointed and never had a conversation with that person. So you want to make sure you're talking to the person that you're looking to make decisions on your behalf, and they have a copy of your directive, as well as anybody else that you would trust to hold that information that you think you may be around. Life is very unpredictable. You might not always be in a circumstance where the person who is immediately with you in a health crisis has that knowledge or access to that information. But the more people who do, the better in this circumstance.
Thank you so much for that. So outside of healthcare, what other important areas to address for end of life planning? Because a lot we have spoken about, planning for a healthcare proxy, what that process looks like. So what other areas should we address that many of us often don't even consider?
Absolutely. And we did focus a lot on kind of that healthcare element, because one of the things we're really trying to address with these conversations is that the knowing what to do in a crisis situation, which is typically in regards to that kind of health and welfare. On the basic end, one could be end of life planning also includes post life. So in terms of your funeral arrangements and your legacy, what do you want in those circumstances? I think a lot of people are more comfortable talking about that than the lead up to death at times. So sometimes that's a good place also to start those conversations, going back to that first question. Another key area is the financial and your estate. So part of the documentation you would want to get in place is to ensure that you have an enduring power of attorney. That is a legal document that puts in place someone responsible for your finances and property if you're no longer able to make those decisions. You must have your capacity, that your decision-making ability intact in place to be able to document and put an enduring power of attorney in place. Also, another key document that you would want to get done, a legal document, is your will. And this is to ensure that after your death, it is very clear what you want done with your property and your affairs. We see a lot of struggle in families when people have been, oh, my family will work it out. They all love each other. They'll split it out. This is a lot resulting in why you see kind of properties running into derelict on island, because families are in conflict over things that weren't specified. So we always really encourage not only to think about your advanced care directive or as part of your end of life planning, but also getting an enduring power of attorney in place and ensuring that after your death, your affairs are also in order to help make things go more smoothly for those you leave behind.
Wonderful. So this pretty much aligns with the previous questions, but again, as a child, a young adult, how can we, or how do we know what level of service or care that our parents may need? Because again, the nature of it, end of life care and planning, it looks different for everyone. So how do we know what type of service or level of care do we distinguish for our parents?
Absolutely. So I think I'll split this into two ways to answer this question. I think it's a great one. I think the first would be, if you're in the moment and there's a crisis going on, your key partner, and even before in planning, especially around healthcare, is your doctor and your physician. As Jeannie said, we are not medical professionals in final steps, and we're also not lawyers. We are community members who want to support community discussion. So when people have very specific questions about what medical treatment should I have, what level of care would I want to go up to or not, those are discussions very much to have with a healthcare professional. In terms of understanding at the time, a little more practically, what type of level of care someone might need at different stages of end of life, it's really important that as the person who's a caregiver, et cetera, that you get a professional assessment. Now that could be done through your GP, or often they're done through a registered nurse. For example, if you're in hospital, and let's say you're going to be discharged out and you need some end of life or support for additional care, there should be an assessment done in hospital that states what your care needs are and what level of care would be required for you if you're going to be discharged home, or let's say if you wanted to go into placement in a residential care home. If you're living in the community and you're noticing your loved one's needs are changing and you're trying to figure out what they really need, again, you can go to your GP, and if they're unable to do that level of assessment, they can refer you to either a private RN, you can go to a caregiving agency or an individual who has a registered nurse who could do this assessment, or you can even be referred to the Department of Health Community Nursing, who will do kind of a long-term care needs assessment to help understand what care plan would be necessary at the stage that they're in. So there are professionals to help you with making those decisions.
Okay, thank you so much. And I think we are at our, I'm sorry.
I'd just like to add, because I've been listening, that as Sarah said, our mandate isn't to really talk about, which conversation we want to have. Our mandate is to get people to feel comfortable to start conversations before they're in crisis about all of these topics. I would like to also add that one of the things that I think families need to consider, and this is, we've had a number of occupational and physiotherapists, and they have all advocated that when you have a home, you should start very early considering all the things that might be needed for you to stay in place. Even the size of your doorways, your bathroom, and also stairwells, all of those things need to be considered before you're there, before you have to start thinking about that rail, or you need to start thinking about living on one floor. So they advocate very much that even when you're planning a house and you're planning on building on, that you need to start to think about things that may be needed if you are disabled or less able.
Exactly. Thank you, Jean Flath, for clearing that up for us. But just to add to our final question, as Final Steps has stated, they are a community group of volunteers assisting the community through this process. So one of the questions as well that was submitted was, should we have an attorney present when completing the forms? And if not, at what stage should we involve an attorney?
Okay, absolutely. You do not need an attorney to create an advance directive. You do not need one to engage in the conversation starter kits, et cetera. These are supposed to be done with you and your family members. And then when you get to the point of writing down the plan into, and if it's about your healthcare, like in an advance directive, then again, we really encourage that you're discussing this with your healthcare professional. Now, if you want to take that plan and attach it or include it with one of a legal document that I mentioned of before, be it of a power of attorney or your will. Some people do this, and they do this with a lawyer, especially if you have a complicated estate or affairs. It is recommended that you do use lawyers in those circumstances that we've been told in the community, however, not necessary. But really, to engage in this conversation, we're talking about engaging between your loved ones and with your healthcare professional team. And then if you do engage with a lawyer for getting your power of attorney in place and your will, then they very much should be aware that you have an advance directive and you would like it attached to one of those documents.
Wonderful. Thank you so much to Jean and Sarah. We truly appreciate you both for providing us with today's conversation on end of life planning. If, again, you want to reach out to Final Steps Bermuda to download their toolkits, they have their information all on their website at finalsteps.bm. And again, if you have questions regarding the healthcare system, we are at the Health Council are happy to assist you in that process and answering any of your queries. But this concludes our presentation for today. And thank you all for joining us, and please enjoy the rest of your week.
Thank you.